The internet is increasingly becoming the go-to place for health information. However, it's often difficult to know which sites are designed to give people the best evidence-based information and which sites are designed to get people to spend their money. Helping people who are online looking for health information distinguish between the good information and the bad information is a first step towards helping them navigate through all of that noise.
Welcome to Module 7 in the Finding and Using Research Evidence, a Guide for Citizens course. In this module, we're going to talk about how to find and use research evidence in other sources. In this course, we've covered the McMaster Optimal Aging Portal to provide illustrations of an approach to support citizens and patients to find and make better use of the best available research evidence for the topics related to aging. However, citizens and patients may be interested in topics that aren't covered in resources designed specifically for citizens, so they may need to look elsewhere. While other resources may not have been originally developed with citizens and patients in mind, they all provide ways that can make it easier for them to find and use evidence. In this module, we'll cover the Cochrane database for citizens and patients' questions about my health, for example, personal health decisions. We'll cover health evidence, which is for citizens and patients that have questions about our health, for example, improving the health of populations or groups. And we'll also cover health systems evidence, which answer questions about our system. For example, how do we strengthen our health system and get the right programs and services to those who need them most? All of these sources focus on systematic reviews, not single studies, and provide ways that help make it easier to identify the relevant research evidence that can be acted on. Now turning to the first source that I mentioned, the Cochrane Library. When citizens and patients want answers to questions about their own individual health, the Cochrane Library has established a one-stop shop for evidence summaries which may be useful to citizens. Cochrane only produces high-quality reviews, meaning that citizens and patients can feel confident getting their evidence from this resource. There are ways to browse, specifically by the health topics that are of interest to you. It helps you identify quickly the relevant evidence that you may be interested in. Individuals can also conduct more specific searches using keywords, and they can filter their searches by new evidence. Each evidence summary starts with a declarative title, which helps to highlight the messages that are most actionable for citizens and patients. There are also other ways that evidence summaries make it easier for citizens and patients to digest this information. For example, Cochrane sometimes adds podcasts which summarizes the main messages from the systematic review underpinning the evidence summary. Moving on from individual questions about my health, citizens and patients may also want answers to questions about the health of their communities. For example, how to improve the health of a group or population. Health evidence was established as a one-stop shop and includes high-quality evidence summaries of studies that answer these types of questions. Searches can be filtered by health topics to quickly look for relevant evidence, and evidence summaries are provided to help highlight key messages that are actionable. Quality ratings are provided to help citizens and patients determine how trustworthy the messages from the reviews are. More specific searches can be conducted using keywords, and filters can be combined with these keywords to find new evidence. Evidence alerts are also provided for citizens who want to sign up and get new evidence in their inbox each month. The type of evidence you can find in health evidence addresses questions such as, how does food pricing affect the dietary behaviors of certain populations? This may also be relevant for people trying to improve the situation in terms of diabetes prevalence in a population. In addition to answering questions about individual health and the health of populations and communities, people might also want to know how to better strengthen their system. And this is when you would go to health systems evidence. Health systems evidence contains research evidence about how to strengthen or reform health systems to get the right programs and services to those who need them. Searches can also be filtered by health topics to quickly look for relevant evidence. Links to actionable evidence summaries are provided, and quality ratings can help citizens and patients determine how trustworthy the messages from these reviews are. As with the other resources, more specific searches can be done using keywords, and the results can be filtered by relevance to their searches and by most recent evidence. As with health evidence, there's an option for a monthly evidence service where citizens and patients can subscribe to a search that they like to receive a prompt each month with the newest evidence on the topics they're interested in. The types of resources contained in health systems evidence could include the resource we're showing to you here, which is about how to make the most of nurses in addressing issues specific to diabetes.